Healthcare workers are getting the vaccine, which is great, but for many of us, we'll have to be patient a little bit longer. Now, that's not necessarily easy, especially when we've waited months for it, and people are tired of wearing masks and stressed about putting family and friends at any kind of risk over the holidays. So let's reset our mindset, our thinking, and our outlook. Probably easier said than done there. Joining us now is trauma psychiatrist Dr. Alauna Curry. Dr. Alauna, thank you so much for taking the time to talk with us this morning. And there are a few topics we do want to tackle, so I want to get right into it. Let's first start with the vaccine. Some people are hesitant about taking it when it's available. What advice do you have for someone who may be anxious about it or may have to overcome a fear of needles to get it?
I think it's really important for us to consider that the vaccine, even though it seems like it's quickly done, the research and the science that it's based on has been developed for years now. When I was in medical school, 12, 15 years ago, they were developing these type of vaccines so that we could have a better way of responding to crisis. So I think it's really important for us to understand the science, and the science says that the risk of being disabled or dying from coronavirus is greater than the risk of possibly having some temporary side effects. And certainly that is concerning to have side effects, but it really is more important to live and not have a disabling condition. And you never know who that may be. It's taken out young people, healthy people, older people, people with pre-existing conditions. It really doesn't discriminate.
Yeah, there's definitely still a lot unknown about this virus. As we mentioned earlier, it's going to be a little while before many of us are able to get that vaccine. So there could be some struggles that likely we'll be facing. What can we do to stay focused about our safety and really just kind of focus on that patience?
Yeah, I think it's really important for us to start talking about emotions and understanding them. So all human beings have an amygdala. This is the part of your brain that creates your emotions. And those emotions are very powerful and they really take a lot of energy. They're very exhausting. But we as a species, we've ignored them. Some people are even told that they don't have them or they can't feel them. But that's just untrue. Everyone has emotions, and those emotions are invisible and powerful. And so because we're not used to dealing with them and talking about them and thinking about them, they're causing us to have a lot of experiences and reactions that we don't understand. And so we don't even have a language for those emotions.
Yeah, there's been a lot of confusing times trying to figure out what's really going on inside our heads right now.
Yeah.
With your expertise in trauma psychiatry, is this pandemic considered a traumatizing time? When you think trauma, I usually think violence, not a pandemic.
Right. Most people think of trauma as something that's overtly violent, but natural disasters, pandemics, traumas are any situation that you eternally experience so negatively that it makes you change the way you think about yourself, other people, and the world. And so traumas are actually, the bar is not way up here, the bar is down here. We all have experienced traumatic things, and the pandemic is definitely one of them. So it's safe to say that 7 billion people are experiencing trauma right now. And so we really need to have the conversation because trauma is treatable. That's what I love about being a trauma psychiatrist. It's really about understanding how it affects your brain and how your thoughts, emotions, and actions all come together related to those traumas.
Trauma is treatable. I like that. That's a good takeaway for today. Dr. Alauna, thank you so much for your time this morning. We appreciate it.
Have a good day.
You too.